Hey guys, so today I'm going to be talking to you a little bit about bipolar disorder and what it is, what it is, and what it is, and the misconceptions that people mostly get about it. So, like, there's different kinds of bipolar disorder, and like when you say bipolar, like automatically the first thing that's going to come to someone's mind usually is that, oh my god, they're the kind of people that get mad for no reason. Well, I just looked up the definition of bipolar disorder, and it says, bipolar disorder is a condition in which people go back and forth between periods of very good or irritable mood and depression. The mood swings between mania and depression can be very quick. Causes, incidents, and risk factors are bipolar disorder affects men and women equally. It usually starts between the ages of 15 and 25. The exact cause is unknown, but it occurs more often in relatives of people with bipolar disorder. Types of bipolar disorder. People with bipolar disorder type 1 have had at least one manic episode in periods of major depression. In the past, bipolar disorder type was called manic depression. People with bipolar disorder type 2 have never had full mania. Instead, they experience periods of high energy levels and impulses that are not as extreme as mania. These periods alternate between episodes of depression. A mild form of depression called cyclothymia involves less severe mood swings. People with this form alternate between hypomania and mild depression. People with bipolar disorder type 2 may be wrongly diagnosed as having depression. In most people with bipolar disorder, there is no clear cause for manic or depressive episodes. The following may trigger a manic episode in people with bipolar disorder. Life changes such as childbirth, medications such as antidepressants or steroids, periods of sleeplessness, recreational drug use. Symptoms. The manic phase may last from days to months. It can include the following symptoms: easily distracted, little need for sleep, poor judgment, poor temper control, reckless behavior, and lack of self-control, binge eating, drinking, and or alcohol or drug use, poor judgment, sex with many partners, spending sprees, very elevated mood, excessive activity, increased energy, racing thoughts, talking a lot, very high self-esteem, very involved activities, very upset or agitated. These symptoms of mania occur with bipolar disorder 1. In people with bipolar disorder 2, the symptoms of mania are similar but less intense. The depressed phase of both types of bipolar disorder includes the following symptoms: daily low mood or sadness, difficulty concentrating, remembering or making decisions, eating problems, loss of appetite and weight loss, overeating and weight gain, fatigue or lack of energy, feeling worthless, hopeless or guilty, loss of pleasure in activities once enjoyed, loss of self-esteem, thoughts of death and suicide, trouble getting to sleep or sleeping too much, pulling away from friends or activity that were once enjoyed. Signs and tests, which is signs of, you can have signs that you'll have it. So, things you can do. Ask your family doctor, recent mood swings, tell them about them or how long you've had them. Perform a thorough examination to look for illness that may be causing symptoms. Run laboratory tests to check for thyroid problems or drug levels. Talk to your family members about your behavior. Take a medical history, including any medical problems you have had and any medications you take. Watch your behavior and mood. So, that's just a little bit about bipolar, what it is and what it is and what you can do. I found out that I was bipolar when I was 15 or 16. When I was 15, I think. But yeah, last year. And people would always tell me, like my family, they'd be like, your moods are changing. And they would always tell me, like, your moods are changing and you're not acting like yourself. Like, that's what I heard over and over. You're not acting like yourself. You're not acting like Marissa. And I was always mad because I was like, what do you mean I'm not acting like myself? I'm normal. This is how I am. And so I was angry for a long time because I didn't want to come to the fact that anything was, mentally wrong with me. I didn't want to, like, I knew that eventually over time, like, I was kind of like examining myself and my moods, and I learned that what my mom and my sister and dad were saying was true, ultimately, and they would tell me, like, I think you're bipolar, and I'd be like, no, I'm not like one of those people, that's not me. I get mad, but because I'm a teenager, that's normal, right? See, like, I didn't know what it was, like, legit, until I sat down with my psychiatrist and she started to tell me, it's not just being mad all the time, and it's not just, your mood swinging around. Like, it's difficult because when you have family that isn't bipolar, and like you feel like they can't relate to you because they don't know what it's like every day to wake up and not even notice a change, that you're different. And like for me, one of the hardest things about my bipolar disorder is that I'm a twin, and my twin isn't bipolar. So like that level of connection that twins have, that close bond, like it's still there, but it's different because sometimes we'll fight, or she'll get down and really depressed because I can be having a normal conversation with her about something one minute, and then I can be breaking down and dependent on her for like weeks at a time because I can't get my thoughts straight. I can't do what I'm supposed to do, like, as a person, because I get so down and so irritated and lonely. Like, that's like one of the major things I feel with being bipolar, is just a complete sense of loneliness. Like, no one can understand or relate to me because they don't know what it's like to wake up and to watch yourself hurt your family through your moods, and like not even realizing you're doing it, and then having them come to you like weeks or months later and being like, your behavior has been hurting me, and you had no idea. So I feel like it's taken a lot away from me because I'm just not how I used to be. And people, like, it's hard for me to keep friends because once they find out I'm bipolar, like, they're like, oh my god, I don't want to have anything to do with her. She's weird. Like, she's gonna be one of those people, like, is she gonna try to hurt me for no reason, just randomly out of the blue one day? Like, no. Like, I'm not a violent person. It's just my mind is different than everybody else's that don't have this disorder. And it's not something you can help, and it's not something, well, not like you can't help it, like you can't take medicine to, take the edge off, or antidepressants or anything, but like, I mean, it's not your fault that you have this. You didn't say, hey God, I want to have bipolar disorder today, it's not something you can just want and get, and you can't grow out of it. I mean, it can get worse with time or more manageable with time, but it's not one of those things that'll just leave you. And I was on a lot of medication for a long time, and people didn't understand why I acted the way I did, because I wasn't like the normal freshman or sophomore. And because, like, you get a feeling of hopelessness, like, when you realize that your disorder is there for good and you can't run from it anymore. Like, in some ways you feel like you're watching your life through somebody else's, because you see everybody that can go to school and be like, yeah, friends, school, rock on, and then you're the one that's sitting there faking a smile, acting like everything's okay, because you have so much going on that you don't want to. It separates you from yourself, and it's really hard, but you can get through it. I mean, I have. It's not been the easiest for me, and it's probably not the easiest for these people with bipolar disorder watching or knowing people who have it. But I'm going to share with you guys something that's on my Tumblr, and I wrote it today specifically for this video to help you guys try to understand what it's like. And since I was drinking Coca-Cola earlier, crap, fail, life. So I was drinking Coca-Cola earlier. It's called Bipolar Bear. It says, today I walked inside my mind, sat down in its most comfortable zone writing, and I decided to share with you some of the truths about being bipolar and dealing with manic depression, dissociative identity disorder, and mild schizophrenia. Everyday life is harder for me than it is for most people at my age. I'm 16 and I already feel like I'm at least 30 years old in my mind. Difficulties of life have pushed me closer and closer to the edge for so many years until one day I found something to relieve that strong, forceful push. I found blades and I found band-aids. I found bulimia and I found starving. I found artwork, I found tears, I found scars, and I found excuses. I found a whole different side of me that I never even knew existed. I found my bipolar disorder, I found my schizophrenia, I found my personality disorders, I found my anger, I found my dependence, I found a lot of things, but the most important thing I found was the realization that I'm not ever going to be one of those people who can have a normal day like everyone else. I'll always have these disorders, and although they're treatable, I'm stuck with them. I'm always going to have the battle in my mind between all the different addictions and all the lies I'm so used to telling. I found that even though I'm different, and even though I have all this emotional turmoil and baggage to carry around, I'm still human, just like everyone else, and that's exactly what people don't realize. I feel sorry for the people who get scared of me when they figure out I'm bipolar. I feel sorry for them because of the way they make painful jokes and don't even realize that it's an everyday struggle for me. I feel sorry for the ones who won't ever get to know who I really am because they've chosen to close themselves off to me, and I most certainly feel sorry for the other people out there like me who feel they have no one to relate to, no one to care, no one to understand what this disorder is really like. It's life-changing, it's hard, it's confusing, it's stressful, it's heartbreaking, it's an illness. I've lost a lot of people because of being a victim of this, and I'm sure that millions of other people have too. Sometimes I can laugh about it, and other times I just want to scream. Sometimes I feel fine, and other times I feel like I'm going to absolutely explode with irritation and the anger it gives me. We all need a reason to live, be happy, and enjoy life. Sometimes we have to make sacrifices to endure things other people can do effortlessly. But sometimes we don't give ourselves enough credit, and that is something I'm very guilty of. We need to learn to stop being selfish. We need to appreciate life and enjoy those little things that we take for granted. We need to stop judging and take chances. Everyone always talks about change, but how are we supposed to change if we don't find a real reason that relates to us well enough to make us get off our lazy butts and do something about this problem? As bad as it sounds, people always promote not judging, and mostly for the sake of attention from others. There are really some people out there who have a yearning heart full of pain, trying their best to make a change and to give light to the sunken, swollen eyes that have been too blinded to see. I guess this is all I have to say at the moment. So I hope that seeing this video has helped you understand a little bit more about bipolar disorder, and if you're going through it and you have no one to talk to, message me and I'll be there for you. And